This segment is sponsored by Children's Hospital of Richmond at VCU.
The doctor is in and you have questions. The American Red Cross is facing a national blood crisis, and this brings a concerning risk to patient care as doctors face difficult choices as to who receives blood and who will need to wait. It is the worst blood shortage in over a decade. Dr. India Sisler, Clinical Director of Pediatric Hematology and Oncology with Children's Hospital of Richmond at VCU, joins us to explain how we can help. It's great to see you, Doctor.
Thank you. Thanks so much for having me.
Absolutely our pleasure. Let's talk a little bit about this blood shortage crisis and what's prompting this.
Well, since the beginning of the coronavirus pandemic, we've had intermittent shortages in the blood supply. The blood is only good for a short time after it's donated, and it's not something that we can stockpile for a rainy day. So we really rely on regular blood donations and regular blood drives to keep our supply adequate. And because of coronavirus, we've had decreased numbers of drives. The Red Cross has had to have less donors in a space because of the need for social distancing. So we have been running at a fairly low supply level off and on since coronavirus started. And then the timing of the recent Omicron surge with the holidays, with bad weather, with the emergence of flu and other viral illnesses has really put us in the spot of having a critically low supply.
It makes sense. There have been so many disruptions, and for donors, it's so much about being in pattern and that habit of maybe a routine donation. So we've been out of pattern, and with so many other things you described, you're feeling that impact. We all are. So it's important to donate blood. I'm sure the messaging here is, let's get back in this habit. Let's reapproach this so that we can start making these donations.
Absolutely. And since we've started discussing this blood shortage, even in the last couple of weeks, we've seen the number of folks who are registered to donate blood increase significantly, which is amazing. So we're asking for those folks to not just let this be a one-time donation, but while you're there, sign up for your next visit and really get back into the habit. You're right. Having any habits right now is really difficult, but this is a really important one.
It really is. And for those folks who were routine donors or who have done this before, they may be somewhat familiar with what that looks like now. Let's talk about, can anyone donate blood? What are the parameters?
It's a great question. And the answer is almost everyone can donate blood. There are a few limitations for folks who are currently sick, for folks who have certain chronic illnesses that may not be under good control. There's a full list at the Red Cross website. So I really encourage folks to look at that list and see if perhaps you might be eligible to donate.
And we've talked a little bit about this being a blood donation crisis in the shortages that are out there. Who is it that we're helping by donating blood?
You are helping so many patients. We personally at VCU take care of pediatric hematology and oncology patients in my clinic. We take care of a fairly large population of patients with sickle cell disease or with other rare blood disorders that require regular blood transfusions to live. Additionally, we take care of pediatric cancer patients. And one of the things that happens with chemotherapy is sometimes we need blood transfusion to support patients through their treatment. So if we cannot give blood and we don't have the available blood to give patients, we sometimes may have to delay or even just cancel chemotherapy sessions. Additionally, we have patients who have suffered traumas who we see at VCU. A lot of folks, sometimes after giving childbirth, there's a huge list of patients, huge list of conditions that may require blood transfusion support. So it's really is a critical need across the entire institution, both the adults and the pediatric institutions.
It sounds like it virtually is a universal need in our medical community. Dr. Sisler, thank you so much for talking with us.
Sure. Thank you so much.
Absolutely. We're going to share a little information so folks can learn more. For more information, you can visit redcross.org/give-blood. And stay with us. Virginia This Morning returns right after a quick break.